Welcome to university and your first student nursing experience. Over the next 3 years you will spend approximately 2,300 hours in practice in a variety of settings.
It might seem like a lot of hours, but when you go into placement you'll be on a variety of different settings, and whether you're doing adult nursing, child health nursing or midwifery, this is your chance to make the most of every learning opportunity that you can.
We're third-year nursing students from Bournemouth University, and we've put together a short film including our top 10 tips for nursing students going on to their first placement.
These are practical tips and advice that we wish we'd known and we feel would be beneficial for your first placement.
When I first went on to placement, I had no hands-on care experience within a hospital or care setting. Had I been given the opportunity to watch a film such as the one that we've provided for you today, I would have felt a little bit more prepared and more confident going into my placement.
Contact your placement at least 2 weeks in advance of your first shift. Contact telephone numbers should be available on your university website following the placement allocation announcement. Don't phone during really busy periods, which are usually when handover and drug rounds are taking place. Busiest times are generally between 7 and 10 in the morning and 6 and 8:30 in the evenings.
It's a good idea to ask who your mentor is going to be and what the shift times are so that you can plan to get there on time. Many departments don't mind you going to visit the placement in advance and may be able to give you a student handbook specific to their setting. If so, take one away as it will give you a really good idea of what to expect. Here is a short clip with advice from Claire Treadray, who owns a care centre in Poole.
Hello, my name's Claire Treadray. I'm from the Branksome Park Care Centre, and in the past 15 years we've looked after over 100 students here. I've got 2 bits of advice for you as student nurses, perhaps going in first or second placements. Firstly, always do a bit of background work about the home you're going to. Try and find out the people who live there, what their illnesses might be, and do some background reading around it. There's lots of people locally who are elderly, and it might be that dementia is quite a big part of the work you'll be doing in a care home. Secondly, always plan your first day. Do a dummy run if you need to get there on time. In the community there might be problems with bus routes, with parking, with all sorts of reasons why you won't get there on time. So always do a dummy run, and it'll go down well if you get there on time for your first day.
Your mentor will show you around, telling you where things are, such as the sluice or treatment room. Ask to spend a few minutes in a treatment room and go through all the drawers so that when someone asks you to get something for them, you know what it is and where to find it.
Hey, could you just get me some tape and gauze, please? Thank you.
On my first day on placement, a patient asked me to help him to use the commode. The only problem was no one had shown me how to put it together. This is the kind of thing that you should become familiar with really quickly.
As a first-year student, working with healthcare assistants can be an invaluable experience. Many of them are a fountain of knowledge and will be able to tell you what you need to know about how a ward works, where things are kept, like vital observation equipment and ECG machines. And they'll also be able to teach you good basic nursing skills, such as how to wash patients, adhering to infection control policies, and making sure that procedures like this are carried out, providing individual care while maintaining respect and dignity to patients.
Another one of our top tips is to always carry your ID badge, a pair of scissors, a pen torch, a spare pen, a fob watch and a notebook. The notebook's especially important to write down door codes, medical abbreviations, anything you want to look up later.
One of the important practice skills for the students to learn is about taking vital signs, because this is something that you're going to be doing an awful lot of when you go out into practice. And so we give you the opportunity to learn how to take temperature, pulse, respiration, peak flow, and blood pressure.
There are some excellent manuals that you can access to help with your ongoing learning of basic nursing skills. We recommend the Royal Marsden Hospital Manual of Clinical Procedures and Fundamentals of Nursing by Cozier and Erb. These will give you clear direction to basic nursing skills and are really helpful as they contain lots of illustrations. Clinicalskills.net is a fantastic step-by-step resource which you will also be able to access through your university database. Utilise hospital libraries. They are really good as you can borrow books for a longer period of time.
Always eat before placement and make sure you keep hydrated, especially when you're working long shifts. It's really important. Also make sure you get enough sleep the night before.
One of the benefits of being a student is that you have more time to talk with and get to know your patients.
It's an ideal opportunity to develop good communication skills, not only with patients, but with family members and other healthcare professionals.
The more you interact with your patient, the more you can learn about them and learn to tailor the care you give to provide person-centred care.
By doing this, you can notice changes in a person's condition, understand the importance of reporting back to staff nurses, and learn how to document interactions that have taken place.
Developing good communication skills is absolutely vital to giving best care and working well in a team.
So our next tip is to always reflect on your shift at the end of each day. This is a good measure of your confidence level throughout your placement, and you can always reflect back and see how you've improved throughout your weeks of placement.
Some days can be hard and you may feel like you've lost confidence. Talk to your mentor sooner rather than later.
And if you don't feel that you can talk to your mentor, talk to somebody else like your academic advisor or your ward sister, but don't let an uncomfortable situation drag on. You want to make the most of your placement.
This is your opportunity to learn as much as you can before you qualify.
Utilise other learning opportunities like escorting patients to other departments such as endoscopy and x-ray, and try to book a day in theatre, time with specialist nurses and study days.
There are masses of opportunities, you just need to be proactive and utilise them.
Try to practice as many skills as you can with your mentor, but make sure you do anything new under supervision. So finally, get involved,
ask lots of questions,
be positive,
be brave,
enjoy it, and good luck!